Welcome to this webinar on international trade and health, hosted by the Center for Trade and Economic Integration. I'd like to thank today's panelists for agreeing to share their wisdom and time with us today. Just as a technical matter, I'd like to point out that the event will be recorded and the recording will be posted on our website later on. All of you can see it if you want. The questions, we will have about 15 minutes of Q&A at the end, or hopefully we'll have some. Please submit your questions through the Q&A, not through the chat, but through the Q&A, and I'll collect together some and pose them directly to the panelists when we get time. Now, the panel we have to address these very important issues is impressive indeed. Dr. Esperanza Martinez, who's head of the health unit at the International Committee for the Red Cross. She's been overseeing delivery of humanitarian health services to populations affected by war and violence. She's also a medical doctor, which I find very useful to have real doctors involved in these discussions of public health. We also have Karl Brauner, who's the Deputy Director General of the World Trade Organization and a former high-ranking official in the German Federal Ministry of Economics. We also have Henrik Isakson, who's at the Swedish Director of Trade Policy at the Confederation of Swedish Enterprises, and Professor Alan Winters, who is a professor at Sussex, one of the long-time icons on the world of trade policy. There aren't many people in this world who've been at it for a lot longer than me, but Alan, I think you count as one of them.
I'm afraid so, yes.
He is also a former director of UK TPO and chief economist at the Department for International Development in the UK, DFID. So he's had government service as well. So just as a way of background, I think we have to say that COVID-19 has not brought out the best of humankind, or at least when it comes to trade. In principle, the trade system will absolutely be essential in providing a response to the COVID crisis. Most of the medicines are built in or produced in global value chains, or at least involve inputs in global value chains, and producing a couple billion units of vaccines in the next few years will definitely require international cooperation. But what we've seen is a rash of export trade restrictions, some of which have come off. The US trade conflicts are flaring up, especially the US-China conflict, which poses an enormous difficulty for medical supplies, since both the US and China are key participants in those global value chains. So with that kind of background, I want to start off with our first presenter, Esperanza Martinez. Now, Esperanza has had a bit of trouble with her camera, but she's on audio. So if I can invite you, Esperanza, 5 to 7 minutes, please. The floor is yours.
Thank you very much, Richard, for inviting me and for bringing the humanitarian perspective into the discussion. I know that you are going to be focusing on policy and trade, but at the end of the day, we are in the middle of a crisis. It's a global health crisis, as it's a global socioeconomic crisis as well. If we look at it from the health perspective, and this is where it began, we do have several issues in terms of the management and the transport of goods necessary for humanitarian action and for medical responses. So I'm just going to give a quick overview of some of the main challenges, and then I'm sure they will be throughout this conversation touched upon whether they are linked to procurement, whether they are linked to trade policies or a specific national legislation. So that will be. I'm looking forward to learning a lot in this panel today. So the first issue has been the fact that the balance between offer and demand has been completely unsettled here. So you have the supply and demand dynamics that normally govern a market have been disrupted by this enormous demand for example, for personal protection equipment that surpass the capacity of any given context. To produce the quantities that were required for the populations, let alone for exporting to other communities. So we saw a lot of protective practices in which several countries' first reaction is, I need to basically block my exports because I need to be prepared for what's coming to my own. And that basically meant that several contexts and several countries that didn't have enough PPE stock, personal protection equipment and items, were facing a scarcity. And we have seen in the news the amount of healthcare workers that have conducted their professional duties without the adequate protection. So that's one element. The second element is the scaling up of production. We have a highly, and again, I am talking about personal protection equipment here. You have a rather centralized production in a few countries, and those countries are unable to produce the goods at the speed and the volume that is required. Then you are going to have a collapse in the market itself, and a collapse in humanitarian operations in our case. So very early on, we saw China affected by COVID itself, and therefore the manufacturing processes in China were badly affected. So it's a country that basically cannot export what it cannot produce. Now, once you have an open production, again, the challenges that arise are more related to transport of goods. So we have the whole dynamic about the shock of this pandemic on the airline industry, and although cargo planes are still moving, cargo planes need to be piloted by someone. So we don't have the human element in the cargo industry. But on top of that, I think the biggest challenges have been really on the import and export restrictions. So we are facing a global pandemic, but at the same time, every country has its own export regulations. And those regulations not necessarily are very conducive to fast-tracking the export of medical goods that could be considered humanitarian cargo. So the export of elements that are banned in one country might be included or blocked by another country's legislation in terms of export. And we have seen a number of fluctuating practices in the sense that countries have, for example, classified certain goods as medical goods, but then given the quality control mechanisms, then they might decide to switch the qualification of those products, and therefore the export mechanisms change. And that delays tons and tons of cargo that is valued in another context. So I think we have seen a number of barriers emerging. And the last one that I want to point out, and I will be very happy to chip in later on in the conversation, is the discrepancy of specifications. So you, for example, have goods, and again, I'm referring to personal protection equipment goods that are labeled or stand or have specifications that are one denomination. We have, for example, N95 masks according to Chinese and American norms, but then you have specifications that are for Europe. So depending on where you source your goods, you are bound to deploy them in one region of the world or the other. And then when you have a pandemic, you need flexibility to be able to say, well, the pandemic is moving from Asia to the Middle East to Africa. And then if you have the warehouses and the goods, you need to be able to move those goods to where they are needed. You find that you can't because the specifications that are embedded within import-export regulations basically don't match the goods that you manage to get hold of. So we do have all of these different dynamics, starting from supply and demand imbalances, then starting from the national legislation and the inability of the system to operate at a larger demand. And the high dependency on productions that were quite centralized in specific countries, that when they were affecting the manufacturing processes, basically have quite a significant impact in the humanitarian sector. So I will stop there for the moment, but just to kind of give an overview of what we have seen so far, starting very early this year and where we are today. I'm happy to come back later. Over to you.
Thank you very much, Esperanza. Just let me ask one clarifying question. These conflicts that you've had or difficulties, which international organization would normally resolve those for you? Would it be the World Health Organization or the World Customs Organization?
Well, normally what we have here is a situation that has affected all the humanitarian organizations. So this is a situation affecting the international humanitarian system. So the UN bodies, WHO included, the Federation, International Federation of the Red Cross and the Red Crescent Movement, Médecins Sans Frontières. So all of us have been exposed to this. So normally what you have, for example, if we look at the testing, the test, if we look at COVID testing, one of the things that we normally do in the humanitarian sector is we look at what has been approved by the WHO. And therefore, with that, it's somehow easy to negotiate with ministries of health the lifting of restrictions on certain goods to be able to meet the need. But when it comes to items like personal protection equipment, it doesn't happen. We don't have that kind of validation body that will allow to say this specific item is actually considered good for this humanitarian pandemic. So no, there is no single mechanism. Now, there have been several efforts within the UN and the humanitarian sector to get together to try to resolve the issues, either bulk orders or to try to operate into lifting some of the restrictions, but it hasn't been successful so far. Over to you.
Thank you very much. Our next speaker is Karl Brauner, as I introduced, Director General of the WTO. And many of us are hoping that the WTO can help sort out some of these problems. Karl, what wisdom can you share with us on this?
Yeah, thank you very much, Richard, for inviting me. As representative of the WTO, we can hopefully contribute in a modest way to resolving some of the problems. So the multilateral trading system aims at providing a reliable framework for members and businesses. And one element of the often cited triad of transparency, predictability, and legal certainty is very much in our focus these days, namely transparency. One effective means of strengthening trade is the provision of timely and accurate information. We have therefore installed a COVID-19 task force, and in the context of our trade monitoring, we now report specially on trade measures that members have taken because of the pandemic. It is important that governments and businesses take their decisions on a broad and reliable basis of facts. For that, they should know also what other players are doing. By May 20, we had recorded 239 trade measures related to the pandemic. The first measures that members took at the early outset, you have mentioned it already, were export restrictions. In principle, they are not allowed. That is clearly spelled out in Article 11, paragraph 1 of the GATT. However, exceptions are permitted to prevent a critical shortage of an essential product. Members rely on that exception and thereby keep within the WTO legal framework. These measures, however, have to be notified. In April, we had only 36 notifications, but had detected 126 measures taken by some 80 members. In order to provide reliable information to the members, we use 3 more sources in addition to the notifications. There are official government statements on the internet. There are the submissions that governments make to other international organizations. And we also use open sources and name them as such. Over time, we have found a shift away from trade restrictions towards trade facilitating measures. In fact, 55% of the mentioned 239 measures related to the pandemic are now trade facilitating. We make our data available on a platform called EPING. It was only introduced in 2016. Today, it has more than 10,000 registered users from 180 countries and institutions. In this case, information can be tailored to users' needs and notifications of items of interest sent out by the WTO to the user in accordance with their interests. Some of the trade facilitating measures are in furtherance with the trade facilitation agreement, such as allowing the use of electronic means for customs procedures. Certifications are made easier. Some members allow deviations from their technical norms in order to facilitate imports of supplies needed to deal with the coronavirus. A very simple example is provided by a country that currently renounces on its dual language labeling requirement. Apart from providing timely and accurate information, the WTO serves as a forum for exchanging views and for coordinating action. On May 15th, we had a General Council meeting that was exclusively devoted to COVID-19. It was held virtually using a secure platform with interpretation. It yielded a record number of interventions with more than 60 delegations taking the floor. On the 19th of May, we had a business dialogue with ICC and B20 and more than 70 attending companies. They shared their experience during the time of the lockdown and stated their needs. The WTO membership is active in a multitude of groups with declarations made at the level of trade ministers. The leadership and the composition of these groups varies. You may find Singapore as a leader, or Canada, or Switzerland, or the G20. There are also statements from other groups of WTO members, Latin American countries, from the Africans, from the LDCs, and also from individual members. Most of them contain appeals for coordinated approaches to deal with the pandemic now and the restart of the economies in time. They deal with the supply of medical equipment, the necessity to maintain value chains, and the mobility of people. There are also declarations on food security by members and issued with the WTO jointly with other international organizations. This is all very welcome. Everybody is committed to the multilateral trading system and demanding action based on the WTO rules. These initiatives must now be merged and turned into concrete action. In line with the demands of business, in our meeting with ICC and B20, a member or a group of members has to take the lead to initiate a discussion on tariff reductions for medical supplies and protective gear. A joint initiative could be taken to enlarge the pharma agreement, which provides for duty-free entry of covered products, increasing both in scope and membership. The trade facilitation agreement implementation could be accelerated. A political discussion on the preservation of global value chains must take place. There is a lot of talk about reshoring production and making nations self-sufficient in the supply of certain goods. This may have a huge impact on the development efforts of the majority of the WTO members. The global value chains are a decisive instrument for developing countries to integrate into the global economy. The value chains allowed millions of people to lift themselves out of dire poverty by the means of paying jobs. The value chains need to be relieved of superfluous bureaucratic burdens to make them as efficient as possible. Businesses may then decide whether regional diversification is desirable. This must be discussed. There is a lot at stake. We must not lose the progress that value chains generated for 2 decades. The WTO now needs leadership from its members to initiate the necessary actions. Thank you very much.
Thank you very much, Karl, for those comments. And I couldn't agree more that this action is necessary. And I must say that the sentiments that you expressed are quite widely heard here in Geneva. And it's one of the reasons that we set up this sequence of seminars, and we hope it does actually lead to something. And it does seem to me that people recognize there is a need. If I could just ask you one specific question, Karl. One of the things that has had a problem is the movement of people during this crisis because of the lockdowns, including people involved in shipping or airlines and things like that. Would that normally be covered under the WTO to say, for example, when we remove the restriction on the movement of people? Is that something that would be coordinated under the WTO, or is there another international organization?
I think this would be part of the services agreement. And here, mode 4. So, yeah, I think this has a relevance for what the WTO does. But of course, here again, there are certain exceptions which would allow members to deviate from their otherwise engaged obligations.
Perfect. Thank you very much. Our next panelist is Henrik Isakson, who I've already said is the Director of Policy for the Confederation of Swedish Enterprises. Henrik, please, 7 minutes, 7 minutes, the floor is yours.
Thank you. First, the mandatory question. Can you hear me?
Yes, perfect.
Good. Very good. Okay, so as a representative of the business community, we are, of course, very worried about the emerging narrative regarding reshoring, and that's what I was going to talk about. So I take the present crisis as the base for what I'm going to say, but I'm primarily talking about long-term issues related to how trade can support public health. So I think it's very dangerous for those people who say that we're so dependent on imports. They argue both from an economic point of view, and now since Corona came along, they also argue from a health point of view. And their arguments are quite simple, but I think they're completely wrong, and we would have less secure supply of vital medicines, etc., if we didn't have imports. That doesn't mean we're fundamentalist. We realize some firms will reshore for good reasons. There could also be nearshoring, where you don't move it all the way back home, but you move it to a location closer to your home country. And there should be diversification. For example, the new EU trade agreement with Vietnam provides opportunities to move some of the eggs from that big China basket to other baskets as well, which is probably very sensible from a business point of view. But the main thing is that any decision to reorganize the value chains and move production facilities here and there should be based on business decisions, and we shouldn't have a politically organized campaign to deglobalize, as it's happening in the US right now, at least from a rhetorical point of view. It's not happening in Europe so much, and we should be glad for that. So because the present way of doing things in global value chains is an efficient way of doing things. The way we do it like this, that is because it is efficient. And we will So sorry, my daughter into it. So sorry. We organize things this way because they're efficient, because they're the best way of containing costs. And if you have big investments in innovation, research and development for new medicines, etc., you need to reap the rewards of those investments, and then you need exports. So some of the products would simply not exist if you didn't have trade. No country can do this on their own, and even if they could, we could go back to the China thing. It's not wise to have all the eggs in the same basket. It's not wise to have them all in China, but it's also not wise to have them all in your own country. So it's not just a matter of costs, but if we do return to the issue of costs, I think that the growing demographic challenge in the rich world, but also in many middle-income countries, it's a good thing. People are getting older, but it's also a costly thing. And in the less developed countries, you have growing aspirations for better public health. That's also a costly thing, but even smaller resources. If you then argue against global value chains and in favor of more self-sufficiency, what you are doing is arguing in favor of higher costs for those public programs that are supposed to support public health, which isn't a very wise thing to do. So we would argue in favor of keeping the global value chains, of course, but we also need to strengthen them, and there are various ways to do that. And one of them was touched upon briefly by Karl Brauner, and that is the WTO Pharma Agreement. So we have argued that you could take that agreement, which is an old one, a plurilateral agreement from '94, which only a few members, the EU, US, Canada, and Japan, and a few others. That agreement eliminated tariffs on pharmaceutical products and some chemicals used to make pharmaceuticals. You could do three things to that agreement. No, you could do four things maybe. One of them is to actually use the updating mechanism in that agreement. It says it should be updated with new pharmaceuticals every third year. That hasn't happened for a decade, as far as I know. If you do that, a lot of new pharmaceuticals will become tariff-free. Secondly, if you also expand the agreement into other health-related products than pharmaceuticals, various kinds of medical supplies and medical technology and PPE products, etc., so that you really cover all essential health products, that would be good. A third thing would be to expand it into more countries, like, for example, the BRICS countries to join as well. And then the fourth thing, in order to also expand it to really poor countries and make it a multilateral agreement instead of just a plurilateral one, we must realize that some of these countries are dependent on tariffs for their government revenue, and donor countries might look into the issue of plugging some of the holes that would appear in these countries' budgets if they cut these tariffs, because the ultimate goal should be to have no tariffs anywhere in the world for any health-related products. That's the best way to support global health. And then one more thing, and that is one issue that I haven't addressed, is the issue of export restrictions. It also needs to be addressed, perhaps in the same agreement, and that's something that I know the next speaker will talk about. So I'm finishing my presentation here. Thank you.
Thank you very much, Henrik. I appreciate what you were saying about trade and diversification. I think a couple things I think are worth saying. One is, when it comes to trade in food, this is an old problem that countries who are dependent upon imports have to worry about the security of their supplies, and whether it's stockholding or diversifying supplies. The fact that you're vulnerable for your imports is an old problem, and in some sense, this medical supply thing should go along those lines, but it's not a brand new product. And the definition of secure supplies is not just keep everything at home, but rather have a diversified supply. The second thing you said about risk and being business driven on the global value chains, there are industries where private industry doesn't sufficiently take account of the risk that they pose by their actions, for instance, finance. But in order to regulate the risk taking by private industries, you need this enormous regulatory process, and probably that would be a very, very bad idea. But anyways, I appreciate the comments you made. As you've introduced the next speaker, Professor Alan Winters, who actually has some ideas on what we should do about this, I turn the floor over to Alan. Thank you, Alan.
Thank you very much indeed, Richard, and thank you everyone for listening. You can hear me?
Yes, perfect.
Good. Excellent. So the session's about trade in medical supplies, but the real issue is access to medical supplies. In a sense, trade is a means, not an end. I'm going to talk about sort of an idea, some proposals for the near term, not this month, next month, they can start, but also not only 2 years from now. It's something we need to address right now. I want to make two preliminary points. Whenever we're thinking about this issue, we need really to be clear what it is we are trying to protect ourselves against. Is it a local issue? Is it a global issue? Is it somewhere in between? And recognize there are sort of trade-offs that arise in different circumstances. For instance, diversification is useful if you're trying to overcome local problems. It's not so much of a solution for a global problem. The second thing is to pick up where Henrik left off and say, we have global value chains because we wanted them. They were very efficient. They're good for profit. And so the question that we need to ask when we think about policy is, so why is it the private sector is getting it wrong? Where are the market failures? Now, Richard mentioned one immediately. Private firms arguably it would have a different attitude towards risk from the social good, and that might call for some regulation. And we need to be clear, if that's the issue, is reshoring the way to go about it, or is there some other way that we need to go about it? You might also think about the lack of incentives for the private sector to do things that are socially necessary. And I think about the big worry that we're running out of antibiotics, because actually investing very heavily for a pill that somebody will take for 7 days and cure their problem is less good than investing in blood pressure medicines that will go on for ever and ever. So I think those two principles need to sort of inform the way we go about things. I think it's very obvious that we need to have stocks of critical equipment, critical supplies, pharmaceuticals. That I think everybody would agree, and we need to make sure we understand who can access those stocks and when. They need not necessarily all be national, but every country needs to be assured, in a sense, that the stocks are accessible when they can get them. It's also true that we do know that systems that are over-optimized tend to be very fragile. And therefore, if you're running everything on 10 minutes stocks of parts, you are probably going to suffer some shocks. And so a bit more redundancy in many systems will be in the interest of every player, but that includes the private sector. What I want to talk about is, so what's the policy contribution that we can make here and now? And the idea is that we want a plentiful and cheap supply, a reliable supply of medical equipment, medical supplies. How do we go about efficient and plentiful? Well, comparative advantage. You want this stuff to be made in the places that are efficient at making them. You want to have some resilience. So you don't want to have all your eggs in one basket, but neither do you want to have 188 national industries producing a particular product. So the basis on which we do this, the whole trading system in a sense, is based on the assumption that you guarantee some sort of market access, and that encourages people to invest. And for the importers, however, you want to guarantee that they can have access to the goods when they need them and not have them arbitrarily cut off. Richard pointed out that we have certainly encountered this in food. The financial crisis, or just before the financial crisis, we were very worried about export restrictions in food. I think it's true to say that food production is probably less concentrated than most medical supplies and pharmaceuticals, and that therefore, in a sense, diversification is a bit easier to achieve. But essentially what I just said is pointing out that every market has two sides, and the two sides each have to want to be there before you can have a market, before you'll gain economies of scale. And so what Simon Evenet and I have suggested is that we should essentially introduce, it's not an agreement in the sense that anyone has to sign it, but a statement, a really clear statement from governments that if they had import restrictions on medical supplies prior to the crisis, and they have now reduced them, they will not put up trade barriers again in those products. In other words, for the exporters, yes, indeed, the market won't be closed again next year once the crisis is gone. For the exporters, their side of the commitment is to say, for 5 years, we're only saying for 5 years because we're not brave enough to sign up for infinity. For 5 years, we will constrain the way that we carry out export restrictions. We're not suggesting that one should ban all export restrictions under all circumstances. It would be beautiful if we could, but let's be real. But at least say, no, they'll be subject to some limitations, some transparency, some limit on the extent to which they're restricted. We're suggesting that this is something that can be done perfectly within the context of the WTO now, if you do it on a most favored nation basis. You say, we won't put up import restrictions against anybody. We will limit our ability to restrict exports to anybody. So anybody, any country can join. We require countries are sort of adhering to this statement of principle to honour both export restrictions and import restrictions, the ban on those. We would also suggest that countries that have found it useful in the past few months to change their standards so far as importing is concerned, and Karl mentioned a case, should at the very least undertake a sort of genuine reflection as to whether the standards actually were working prior, or were they actually some sort of covert restriction. You can't do without standards, least of all in medical equipment, but on the other hand, you don't necessarily need a perfectly unique national standard. The important thing about this is that it can't really be blocked by anyone, because no one is having to sign something to bring an agreement into existence. It's a statement that you make. Why would the importers do it? Well, indeed, they've discovered that they need imports. Imports are suddenly back in fashion, and those of us interested in trade should not forget the rhetorical value of that. What should the exporters do? You can see that they say, oh, no, we won't restrict exports until they want to do it. The point is, I think, the statement that we reside, our trade is managed, in a sense, by a country which has signed or made this commitment, should give those exporters a considerable advantage in the market, in the sense to say, you can buy from us because we are committing that you can buy next year, you can buy the year after. And so we certainly would, as it were, suggest that exporters have the right to say, we are on the side of the perpetual suppliers and you can trust us. There are a few more details that I can go into. It's all written up in the paper that Simon Evenet and I produced a couple of weeks ago, I guess. It's on the UK Trade Policy Observatory website and also the Global Trade Alert. It doesn't solve every problem. It's not intended to solve every problem, but it is intended to say, just look around at the last few months and think, has that been an edifying spectacle? Actually, there's something we could do to try and prepare ourselves in case COVID comes back again or for something else. And indeed, it might even be a little step towards reversing the trend towards non-cooperation and actually cooperating on something. So let me leave it there. I'm happy to take questions.
Thank you very much, Alan. So the questions have, just to remind the participants that you can put in questions for Q&A, and there haven't been many yet. But what I would like to do is take the occasion to ask Henrik to react to what Alan said, whether you thought, Henrik, that would be a popular thing with the industry. And then I'm going to ask Karl to react whether he thought that there would be any possibility of, I'm sorry to put you on the spot, Karl, but in any case, maybe whether it's possible to organize this in the WTO. But let me start with Henrik. What would you think industry would react to the proposals of Alan?
Well, I know at least how the Swedish industry would react, and I wouldn't be surprised if at least the European industry in general would react differently, because when I read the article from Alan Winters and Simon Evenet, I thought the idea was a very good one, a very sensible one, a quite innovative one. And I thought we should actually use our influence to try to get the ball rolling in this direction, to try to tell politicians and policymakers and the Commission and others that this is something they should look into. And then I decided, before we do that, we need to check so that the Swedish medical devices industry, that they have a special organization, and also the pharmaceutical industry, they have another one, that they're not against this for some reason that I could not foresee. And I've actually done that the last couple of days, and they're not. They're very much in favor of this. They think this is a good idea, and we will be actively trying to using various channels to support this idea. We think it's a good one. The only thing that I could add is, yes, and understanding the way Alan Winters describes this, that's good. A formal agreement would be even better. But of course, if we cannot have a formal agreement, then I guess informal understanding is better than nothing.
Thank you very much, Henrik. Also, Esperanza, once Karl gets done reacting, I'm going to ask you whether this would help solve some of the problems you raised. Karl, what do you think?
Yeah, thank you very much. I read this report, or this proposal from Helen and Simon. I am one of the consumers of anything that Simon produces, and I think it is always very intelligently done. I'm happy to now also see Helen. I think it is a good proposal because it takes a very soft approach. And I think when you are in an organization like the WTO, you need a soft approach to show that cooperation is possible. It also has got a moral element in it. And I think it builds on what we actually have in the agreement. Whenever an exception is granted, it must be done proportionately, it must be temporary, it must be done in a non-discriminatory fashion. So we need a member in this member-driven organization. And as Helen and Simon are working for the UK, and the UK is now celebrating its liberation, why doesn't the UK take it forward? Thank you.
Excellent idea. Esperanza, would you like to comment on the proposal that Alan and Simon have proposed to have a kind of a discipline on the export restrictions and possible exchange of removing technical barriers to trade, some of the things you mentioned, from the perspective of the ICIR? Would you think it would solve some of the problems you saw?
Thank you very much. And as you said, lifting the restrictions, and it can be done sooner rather than later, even on a partial manner. It's going to have a great impact, particularly for countries that today don't have their own manufacturing capacity, and they don't have the ability to withstand the shocks that COVID-19 is bringing about. One of the things that I really like, so I picked up from Alan's intervention, this element of not in 1 or 2 years, but short term, soon. What can we do now? And I think that is a very relevant point. We have at the same time to think about what about the 1 or 2 years, because we have the issue of vaccine development, and then the vaccine development, the registration, and then the trading of that vaccine. It also is going to bring about a lot of dilemmas in relation to protectionism, in relation to which communities or which societies are going to benefit from this. And the element of cooperation and global solidarity is going to be extremely important to make sure that whatever development happens, it's going to be prioritized for example, frontline healthcare workers and really vulnerable groups of population, disregarding of where they live, whether they live in the UK, in Australia, the US, or Central African Republic. So I think those elements are, they need to build upon these short-term measures, but there is a larger discussion that is coming. And if it doesn't happen with COVID, because let's say there is no COVID vaccine, it might happen in the next pandemic. So we need to be prepared for that. Thank you.
Thank you very much. So let me pick up. We have a couple ringers in the audience. Patrick Lowe has sent in a question, and I think I'm going to direct it first to Alan Winters. The issue of critical mass and free riders. In fact, if you look at the supply of medical equipment and pharmaceuticals, it's quite concentrated, and so really we probably wouldn't need hundreds of 100 countries to agree to this thing. You probably really do need 10 though. So are you worried about a critical mass issue in free riders, Alan? And then maybe Karl, you could weigh in if you feel comfortable doing that.
Well, I certainly agree with Patrick. In a sense, if one signed up 10 major players, the whole thing would look very much more secure. But it's not a critical mass agreement in the sense that it can only be operated with a particular number. Essentially, it's saying that the benefits are open to everyone, so you have to worry about free riding, but there is a private benefit in the sense that exporters from countries that are signatories, that have made this commitment in some fairly serious way, ought to have some market advantage. And I say I certainly would not do anything to stop them from advertising and taking advantage of that.
Right.
So, lots of people, lots of big players, absolutely ideal. But in some sense, it doesn't have to wait before it's useful to get critical mass.
Thank you very much. So, Karl, if you could talk about the critical mass issue or how this might go forward. Henrik mentioned that the pharmaceutical agreements might be a vehicle, but
yeah, let me just say that according to our own research, the US, Germany, and Switzerland produce 35% of all the COVID-19 relevant medical products. That comes up to $944 billion US dollars. And it is China, Germany, and the US that export 40% of all protective gear. And then those countries are also among the 10 largest importers. So I think there is a really good interchange of exporting and importing. And if you get those players on board, so I just mentioned 5 countries. If you got those 5 countries on board, you would have already covered a lot. And yes, the pharmaceutical agreement is the agreement on which one could build by, like what Henrik said, increasing the product coverage and then also increasing the membership. I don't see much of an issue of critical mass because of the figures and the group of countries that I just gave you. We need somebody who pushes it.
Thank you, Karl. Kent Jones has also sent in a question. He asked, is there some sort of state of consensus or feeling of the group that from the General Council that there would be a willingness to go forward? So you've said a couple times we need a leader, and I think there are some. We're going to have a seminar next week where we're trying to talk among some of the diplomats to see if we can find. But is your sense that this is something people are open to, and we just need a spark, Karl?
I think one has to try it because, and one should try it immediately because as the pandemic goes away, the incentive probably lowers. But everybody is talking about how COVID-19 will change the world, and there is a whole stream of people who talk about more solidarity and more responsibility towards the environment and what have you. We should use this sentiment at this point in time, and we are a member-driven organization, so it must be a member who picks it up, and I think it's worthwhile a try.
Thank you very much. So let me pose a general question to the panel. Whoever can answer this would be welcome. Is the WTO able to act fast enough to get these sorts of things in line for, let's say the first wave is somewhat past, but this fall already people are thinking about a second wave. And moreover, this time it was all about protective equipment. The next one, which is coming up, is the pharmaceuticals, either treatment or vaccines or testing. So it'll switch to a different pattern. But it's also worthwhile saying that as the virus spreads through the emerging world, the millions of cases that we see now could turn into tens of millions of cases. So the problem could amplify quite remarkably as the cold weather goes down to the south. So do you think it is possible we could do something in the time we have, or is this really fighting last war by the time we get done? Alan, do you have some ideas?
Well, yes, I suppose I do. The guiding idea, in a sense, that Simon and I had in fixing the details of our proposal was that it didn't require negotiation. It merely required you to nail your principles to the church door and stick to them. And therefore, in a sense, like Karl, I really think we need a champion. I have actually suggested this in Whitehall, that they're not used to listening to me for a variety of reasons. Hasn't worked yet, but you never know. But yeah, we need a champion. But then, in a sense, it's quite straightforward for countries to do it. I perfectly agree with Henrik. I thought what Henrik said was very realistic. It would be better to have a formal agreement. And a formal agreement with some sort of dispute settlement. But let's get real about what we will get done in time, for the next few months. So I think the point I would make is that I don't know that every country is going to be signing up by December, but one could get coalitions of the willing, and hopefully some of the willing and the large, and that would sort of set the ball rolling. The really important thing is no one has to wait for anybody else.
All right. Henrik, can I ask you, do you think the WTO is the right place to do this, or maybe the World Economic Forum or the G20 or APEC? Are there other, is the WTO the right place to do this? We're sitting in, I'm Swedish, a couple of us are sitting in Switzerland, so we think the WTO is the right place. But reflecting broadly, are there other venues?
The WTO would be the preferable place to do it, but not the only one. I've personally participated a long time ago in negotiations about subsidies to the steel sector that took place in the OECD, but where the idea was, if there ever was an agreement, to move it to the WTO to administer it once it was finished. It never was finished. But there are various venues, OECD and G20 and so on, where you could discuss these things. And you could do it perhaps initially as an understanding, the way Professor Winters is talking about it. And then maybe when the time is ripe, you could move it to the WTO and transform it into a formal agreement with dispute settlement and all that. But you shouldn't be too ambitious in the beginning, I agree totally. We should start with what we can do quickly and easily. And if that's the easiest way to do it outside the WTO, let's do it. But if we can do it inside, let's do that. Let's be pragmatic. The arena for doing this is not the most important thing.
Very good. Karl, do you have a reflection on that?
Yes, you asked at the very beginning whether the WTO is fast enough. It all depends on whether a member assembles the energy and then gets enough support for it. At the very beginning of this webinar, you said that the crisis has not brought about the best from human beings. I think one needs an approach where you show that you are good citizens of the system. And a few members could get together to set the example of being good citizens of the system. And if it were those that I mentioned as the big producers, exporters, importers, consumers, this could set an example. I think things are possible if you want them to be done.
Thank you very much. Let me try and round out the questions a little bit more. I think one of the interesting things that this has brought up is that the entire world trade system was based on coordinated reduction on import restrictions, because that was in some sense the big problem when the WTO was set up. Countries were trying to protect their markets. And when the WTO was set up, when the GATT was set up, people were very alive to wartime shortages and embargoes and things like that. So the GATT did leave these loopholes for export restrictions. And there's been much less kind of debate or discussion or negotiation on exchange of not doing export constraints. But this time it's about medicine, but it's very easy to think about in the environmental crisis that food restrictions could come back again, or natural resource restrictions, or all sorts of restrictions as we get these idiosyncratic disruptions. Let's just say that the Rhine River dries up and nobody can ship out of Germany that way. That would lead to all sorts of problems, all sorts of restrictions. Do you think that we could get the WTO into the business of negotiating prohibitions or constraints on export restraints, not just on medicines, but more generally? Is this an opportunity to move us into thinking about liberalizing export restraints? Takers?
I wish. I think that would be excellent. I have thought for quite a while and even written, but in the long run, it seems to me that export restraints are actually a worse form of cancer trading system than import restrictions. Absolutely no one is going to sign on to a system for which you are going to be held to ransom under some circumstances, or possibly cut off from things you've come to rely on. And therefore, in some senses, we are beginning to appreciate the value of imports. And the cases you mentioned, Richard, food, as well as pharmaceuticals, medical equipment, are all going to be important. It does seem to me that the balance of interest in the trading system towards what we should worry about may change. So I certainly would like to think we could move in that direction. I would like to lend my small amount of energy to it. I'm not sure it's going to happen immediately, though, but in a sense, a little agreement of the sort we're suggesting, maybe that is the chink in the armor, and we'd gradually be able to expand it.
Thank you. Let me make a suggestion as to how to think about this. In some sense, the trading system has always allowed for unfair trade barriers like anti-subsidy and anti-dumping tariffs, but required some sort of discipline and procedures as to how they were done, and required countries to talk about what they were doing and justify it and have it time limited. To a certain extent, I think one of the things I took out of Helen and Simon's proposal was that we could move towards a more systematic treatment of how do we grant exceptions to the export restraints, for example, that are forbidden de facto except in exceptions. The same thing is true. You can put on dumping duties, but you need some sort of procedure. And the negotiations we've seen, for instance, in the Uruguay round, were very much about the procedures, different for different countries. And so I wonder if that's not one of the things we could move towards, is a more disciplined, if you do it, it has to be more disciplined and involve some process. Any reactions to that?
I'm in favor.
Very good.
Yep. I think one of the problems is that during the time of the conception of those rules and regulations, everybody was oriented to either preserving their own security, mainly in food, or seeking big profits in exports. Actually, exports were considered to be the healing for any troubled national economy. There was a lot of emphasis, I think in some countries, especially the one where I come from, there's still this enormous emphasis on exports. And there was no thinking on that export restrictions could actually be an element of great importance, because everybody was striving for exports. So I think we have to pick up this issue and think about it in more depth. Perhaps Simon and Helen will write something that could trigger off some interesting discussion. Thank you.
And Richard,
please.
I want to pick up on a notion that Karl wrote, and it's the fact that we have today this sentiment of global cooperation and solidarity, and it's important to capitalize on that. But I think it's also super important to remember that we are facing a crisis that is likely to repeat unless stronger measures are in place. There were signals that indicated that globally we were not prepared to face a pandemic of this nature, and here we are. So yes, we need to capitalize on this sentiment, but at the same time, we need to think on how we make it more permanent, how the measures that we take today are the foundations of something stronger that will allow us to basically strengthen our capacity to respond to a new pathogen in 1 year or 2 years or 3 years. So I think it's both. It's thinking about today, and we definitely need to contain this fire, but we need a good firefighting plan. for the long term. And then both things need to come together. Back to you.
Thank you very much, Esperanza. I think that was the perfect closing statement, so I will forego making one myself. Temporary right now, and let's try and move it towards fixing it in the longer run. So with that, I will close this workshop. Thank you very much, everybody. I will remind you that the recording of this will be posted on our website in case you want to show it to somebody who couldn't actually come live. And I want to thank one more time the participants for sharing your time and your wisdom. And I want to thank the staff of the Center for Trade and Economic Integration, in particular Angelica Zanzinella and Tamara Pirone, for organizing this whole thing. Thank you very much. And we'll see you at another seminar very soon. We don't have one scheduled, but we're doing them all the time. Thank you very much and goodbye.